Imagine a vibrant tapestry, intricately woven with threads of memories, emotions, and experiences. Now, picture those threads slowly unraveling, leaving behind gaps and faded colors. This is the heartbreaking reality for millions living with dementia, a group of conditions that affect the brain's ability to function properly. One day, you might notice a loved one struggling to recall a familiar name or misplacing their keys more often. While these could be simple signs of aging, they might also signal something more serious. Dementia is not a normal part of growing older. It's a term that encompasses various brain disorders, each impacting cognitive abilities in different ways. Understanding the nuances of dementia is crucial, especially when it comes to Alzheimer's disease, the most common form. This complex condition gradually erodes memory, thinking skills, and even the ability to perform simple daily tasks. As we delve deeper into the world of dementia, we'll unravel the mysteries surrounding these conditions, exploring their differences, causes, and potential treatments. Dementia is not a single disease but an umbrella term. It encompasses a range of conditions that affect the brain. These conditions all share a common thread. They impair cognitive function, impacting a person's ability to think, remember, and reason. Imagine dementia as a large tree with many branches. Each branch represents a specific type of dementia, like Alzheimer's disease, vascular dementia, or Lewy body dementia. While each type has unique characteristics, they all ultimately lead to a decline in cognitive abilities. This decline can manifest in various ways, affecting memory, language, problem-solving skills, and even personality. Everyday tasks that were once effortless, like following a recipe or managing finances, can become increasingly challenging. Understanding that dementia is a broad term is the first step in navigating this complex landscape. Among the many branches of the dementia tree, Alzheimer's disease stands out as the most prevalent. This progressive brain disorder gradually destroys brain cells, leading to a steady decline in memory, thinking, and behavior. Alzheimer's disease is characterized by the presence of two abnormal structures in the brain: amyloid plaques and tau tangles. Amyloid plaques are sticky clumps of protein fragments that build up between nerve cells, disrupting communication pathways. Imagine these plaques like roadblocks on a highway, preventing signals from flowing smoothly. Tau tangles, on the other hand, are twisted fibers of another protein that accumulate inside neurons, disrupting the transport of nutrients and essential molecules. These plaques and tangles progressively damage and kill brain cells, leading to the devastating cognitive decline associated with Alzheimer's. Understanding these unique hallmarks helps differentiate Alzheimer's from other forms of dementia and paves the way for targeted treatments. While the terms dementia and Alzheimer's disease are often used interchangeably, it's important to remember that they are not synonymous. Dementia is an umbrella term encompassing various conditions that affect cognitive function, while Alzheimer's disease is a specific type of dementia. Think of it this way: all squares are rectangles, but not all rectangles are squares. Similarly, all cases of Alzheimer's disease fall under the umbrella of dementia, but not all dementias are Alzheimer's. Understanding this distinction is crucial for accurate diagnosis and effective treatment. While there is currently no cure for Alzheimer's disease, early diagnosis allows for interventions that may slow its progression and improve quality of life. Section 5. Unraveling the causes, how dementia takes hold. The intricate workings of the human brain remain a source of ongoing research, and the causes of dementia are complex and multifaceted. Age is a significant risk factor, with the likelihood of developing dementia increasing as we get older. However, it's important to remember that dementia is not a normal part of aging. Genetics also plays a role, with certain genes increasing the risk of developing specific types of dementia, such as Alzheimer's disease. Lifestyle factors, such as smoking, lack of exercise, and an unhealthy diet, can also contribute to the development of dementia. Other factors, such as head injuries, stroke, and certain infections, can also damage the brain and increase the risk of dementia. Long-term exposure to certain substances like alcohol and drugs can also have detrimental effects on brain health. Understanding these risk factors is crucial for developing effective prevention strategies and targeted interventions. The question of whether dementia can be reversed is complex and depends on the underlying cause. In some cases, such as dementia caused by vitamin deficiencies, hormone imbalances, or thyroid problems, treatment can reverse the cognitive decline. However, for most types of dementia, including Alzheimer's disease, the damage is irreversible. Think of it like a delicate flower that is wilted. While providing water and sunlight might revive a dehydrated flower, it won't bring back a flower that has completely withered away. Similarly, while addressing reversible causes can improve cognitive function, it cannot undo the damage already inflicted by conditions like Alzheimer's. Despite the lack of a cure for most forms of dementia, research continues to explore potential treatments that may slow its progression and alleviate symptoms. Early diagnosis remains crucial, as it allows for timely interventions that can optimize brain health and enhance quality of life. Recognizing the early warning signs of dementia is crucial for seeking timely medical attention and potentially slowing the progression of the condition. While occasional forgetfulness is a normal part of aging, dementia manifests as a persistent and progressive decline in cognitive function. Memory loss that disrupts daily life, such as forgetting important dates or events, repeating questions, or relying heavily on memory aids, can be a red flag. Difficulty completing familiar tasks like following a recipe or balancing a checkbook can also signal cognitive impairment. Changes in mood or behavior, such as increased confusion, disorientation, or withdrawal from social activities, should also raise concerns. If you notice any of these warning signs in yourself or a loved one, it's essential to consult a healthcare professional for a proper diagnosis and to discuss available treatment options. While there is currently no cure for most forms of dementia, including Alzheimer's disease, various treatment options can help manage symptoms, improve quality of life, and support both individuals living with dementia and their caregivers. Medications, such as cholinesterase inhibitors and memantine, can help improve memory and thinking skills in some individuals. Therapy, such as occupational therapy, speech therapy, and cognitive stimulation therapy, can provide strategies for coping with daily challenges, improving communication, and stimulating cognitive function. Creating a supportive and structured environment can also make a significant difference in the lives of those living with dementia. Support groups provide a safe and understanding space for caregivers and families to share their experiences, connect with others facing similar challenges, and access valuable resources. Remember, navigating the journey of dementia requires a multifaceted approach that addresses medical, emotional, and social needs. While the diagnosis of dementia can be overwhelming, it's essential to approach the journey with a sense of hope and empowerment. While we cannot completely eliminate the risk of dementia, adopting a brain-healthy lifestyle can significantly reduce our chances of developing this debilitating condition. Engaging in regular physical activity, maintaining a healthy weight, and following a balanced diet rich in fruits, vegetables, and whole grains can all contribute to optimal brain health. Challenging our minds through lifelong learning, puzzles, and social interaction can also help keep our cognitive skills sharp. Early detection and intervention remain crucial, as they offer the best chance of slowing disease progression and improving quality of life. By embracing proactive measures, staying informed, and supporting ongoing research, we can pave the way for a brighter future for ourselves and generations to come.